If you are taking amlodipine, losartan, or lisinopril for your blood pressure, there are 9 things about these medications that your doctor may not have had time to fully explain during your last appointment. Some of them involve foods you might be eating every day without realizing they could interfere with how your medication works. Others involve warning signs that are easy to dismiss as just part of getting older, when they are actually your body trying to tell you something important. And one of them, which we will cover near the end, involves a mistake that sends thousands of older adults to the emergency room every single year simply because they didn't know it was a risk. We are going to go through all 9 of these together, one at a time, in plain language, without the confusing medical jargon that makes so many health videos hard to follow. By the end, you will have a clearer picture of what these medications are actually doing inside your body, what to watch for, and what questions might be worth bringing to your next doctor's visit or pharmacy consultation. And stick around for number 8 in particular, because it involves a decision some people make with the very best intentions, one that feels completely reasonable in the moment, but can actually put them at real risk without them ever realizing it until it's too late. Think for a moment about someone you may know, a neighbor, a sibling, a friend from church, or the community center who was told at a routine checkup that their blood pressure was a little high. Maybe there were no symptoms at all. Maybe they felt perfectly normal, going about their days exactly as they always had. That is often exactly how this story begins, because high blood pressure so rarely announces itself. It doesn't come with a warning bell. It simply builds quietly in the background, and the only way anyone finds out is through a cuff wrapped around the arm and a number on a screen. Before we get into it, it helps to understand why so many people end up on one of these 3 medications in the first place. High blood pressure is sometimes called the silent condition because it rarely causes obvious symptoms on its own. You cannot usually feel your blood pressure rising. There is no ache, no warning twinge, nothing that tells you something is wrong. That is exactly why doctors reach for medications like these. So often they are not treating a feeling, they are treating a number, one that, left unaddressed, can quietly put extra strain on the heart, the blood vessels, the kidneys, and even the brain over time. Amlodipine, losartan, and lisinopril are 3 of the most commonly prescribed blood pressure medications in the world, and there is a good chance you or someone you know has taken at least one of them. But here is something that surprises a lot of people when they first learn it. These 3 medications are not the same type of drug. They do not work the same way inside your body, and because of that, they come with different things to watch for. Let's start with the first thing every senior taking one of these medications should understand. Number 1, these medications belong to 3 different families, and knowing which family yours belongs to can help you understand your own body's response to it. Amlodipine belongs to a group called calcium channel blockers. Think of the muscles lining your blood vessels like a fist that is gripping tightly. Calcium channel blockers help that fist relax, which allows blood to flow more easily and lowers the pressure inside the vessels. Losartan belongs to a different family called ARBs, short for angiotensin receptor blockers. And lisinopril belongs to a related but distinct family called ACE inhibitors. Both losartan and lisinopril work on a hormone system in your body that controls how tightly your blood vessels squeeze. They essentially turn down the volume on a signal that tells your blood vessels to constrict, which allows them to widen and lowers your pressure. Because these 3 medications work through different pathways, some doctors may prescribe more than one together, using them almost like a team, each one tackling the problem from a different angle. If you are taking more than one of these, that is often intentional, not a mistake, but it is still worth confirming with your doctor or pharmacist that you understand why each one was added. Understanding which family your medication belongs to is not just an academic exercise, it actually changes how you should think about your own body's reactions. Imagine 2 people, both in their late 60s, both told they need medication for their blood pressure. One is started on amlodipine, the other on lisinopril. A few weeks later, one of them notices their ankles look a little puffier by the end of the day. The other develops a cough that lingers for no apparent reason. If neither of them understood which family of medication they were taking, both might assume something is seriously wrong, perhaps even worry about their heart or their lungs. But if they understood the basic mechanism behind their specific medication, that puffiness and that cough would make a lot more sense as known explainable effects rather than mysterious new symptoms to panic over. That is really the heart of why this first point matters so much. Understanding the category your medication falls into gives you a framework for making sense of what your body is telling you. That difference in how they work is also the reason they come with different side effects, which brings us to the second thing worth knowing, one that catches a lot of people off guard. Number 2, each of these medications tends to cause a different signature side effect, and recognizing yours could save you an uncomfortable and unnecessary guessing game. With amlodipine, one of the most common things people notice is swelling in the ankles or lower legs. This happens because of how the medication affects the small blood vessels, and while it is usually not dangerous, it can be surprising if you don't know to expect it. Some people even worry it means their heart is failing, when in most cases it is simply a known and fairly common effect of the medication itself. With Lisinopril, the standout side effect is a dry, tickly cough that does not seem to go away, sometimes described as feeling like something is stuck in the back of the throat. This cough is actually well documented and is thought to happen in a meaningful percentage of people taking ACE inhibitors like Lisinopril. It is not caused by a cold or allergies, and cough medicine typically will not help because the cough is coming from the medication itself, not an infection. Losartan, interestingly, was partly developed as an alternative for people who could not tolerate that Lisinopril cough, and it tends to cause it far less often. Knowing which of these patterns matches what you are experiencing can help you have a much more focused, useful conversation with your doctor instead of simply saying something feels different lately. There is also a broader side effect that tends to show up across all 3 medications to varying degrees, and that is fatigue, a sense of being more tired than usual, especially in the first few weeks after starting a new medication or adjusting a dose. This makes sense when you think about what these medications are actually doing. Your body has spent years, sometimes decades, adjusting to a certain baseline of blood pressure. When that baseline shifts, even in a healthy intended direction, your body needs time to recalibrate. For most people, this early fatigue fades within a few weeks as the body adjusts. But if it persists, or if it is severe enough to interfere with daily activities, that is worth mentioning at a follow-up visit rather than simply pushing through and hoping it improves on its own. Your doctor may want to check whether the dose needs adjusting or whether something else entirely unrelated to the medication might be contributing. Now, here's something that connects directly to the next point, because side effects are not the only thing you need to watch. What you eat and drink can also change how these medications behave in your body, and one interaction in particular surprises a lot of people. Number 3, if you are taking amlodipine, grapefruit is worth knowing about. Grapefruit and grapefruit juice contain compounds that can interfere with an enzyme system in your liver responsible for breaking down certain medications, including some calcium channel blockers. When that breakdown process is disrupted, more of the medication can build up in your bloodstream than intended, which can intensify its effects, including lowering your blood pressure more than expected and increasing the risk of dizziness or lightheadedness. Not every calcium channel blocker interacts with grapefruit the same way, and the effect can vary from person to person. So this is exactly the kind of question worth asking your pharmacist directly. Does my specific medication and dose have a grapefruit interaction I should know about? Pharmacists deal with these questions constantly, and they would much rather answer it in 30 seconds than have you find out the hard way. This is also a good moment to mention something that applies more broadly than just grapefruit. Whenever you start a new medication, whether it is prescribed by a doctor or something you pick up over the counter or even an herbal supplement recommended by a friend, it is worth doing a quick interaction check, either with your pharmacist or through a reliable resource your doctor recommends. Supplements in particular are easy to overlook because many people assume that if something is labeled natural, it can't possibly interact with their prescriptions. That assumption is not always accurate. Certain herbal supplements, including some marketed for heart health or circulation, can independently affect blood pressure or interact with how these medications are processed by the body. None of this is meant to make you afraid of every pill bottle in your cabinet. It is simply a reminder that a 30-second question to your pharmacist is one of the easiest, most underused tools available to you. While we're on the topic of things that can quietly change how your medication behaves, there's a mineral that deserves special attention if you are taking either Losartan or Lisinopril, and it's one that a lot of well-meaning people accidentally increase without realizing it. Number 4. Both Losartan and Lisinopril can raise potassium levels in the blood, and this becomes especially important if you are also using a salt substitute. Many popular salt substitutes on the market are not actually salt-free. They are potassium-based, designed to give food a similar taste while reducing sodium. That can be a great choice for some people, but if you are taking Losartan or Lisinopril, adding a potassium-based salt substitute on top of a medication that already tends to raise potassium can push your levels higher than intended. Elevated potassium, known medically as hyperkalemia, can in more serious cases affect your heart rhythm. This does not mean you need to panic about every banana or every baked potato. Potassium from whole foods in normal amounts is rarely the concern here. The bigger red flag is combining these medications with concentrated potassium sources like salt substitutes, certain supplements, or high-dose potassium tablets without your doctor knowing about it. If you use a salt substitute regularly, it is worth mentioning this specifically at your next appointment because it is a detail that can easily slip through the cracks otherwise. It is worth pausing here to say clearly that this is not a reason to avoid potassium-rich foods altogether. Foods like bananas, oranges, potatoes, and leafy greens are part of a healthy diet, and for most people without a specific reason to restrict potassium, they remain perfectly fine to enjoy. The concern here is really about concentrated sources, particularly salt substitutes and standalone potassium supplements, especially when combined with a medication that already nudges potassium levels upward. This is exactly the kind of nuance that is easy to miss if you are only skimming a medication label, which is one more reason routine blood tests, which we will talk about next, matter as much as they do. Now, here is something that ties directly into that last point, because potassium is not the only thing your doctor needs to keep an eye on when you're taking these medications. Number 5. If you are on Losartan or Lisinopril, your kidney function is something your doctor will likely want to monitor periodically through blood tests. Both of these medication families work in a way that affects blood flow to the kidneys, and for most people, this effect is either neutral or even protective over the long run, particularly for people with diabetes or certain kidney conditions. But in some cases, especially if someone becomes dehydrated, is taking certain other medications, or has existing kidney concerns, these drugs can temporarily affect kidney function in a way that shows up on lab work before it shows up as any noticeable symptom. This is exactly why doctors often order routine blood tests after starting or adjusting the dose of these medications, and why skipping those follow-up labs is not something to brush off, even if you feel completely fine. Feeling fine and having stable kidney function are not always the same thing, especially early on, which is precisely why the lab work matters more than how you feel in the moment. One situation worth being especially aware of is illness involving vomiting, diarrhea, or reduced fluid intake, such as during a stomach bug or a hot summer stretch where you may not be drinking as much water as usual. Dehydration changes how these medications behave in the body, and the combination of dehydration with Losartan or Lisinopril can occasionally cause a temporary dip in kidney function. This does not mean you need to stop your medication the moment you catch a cold. But if you are dealing with several days of significant fluid loss, it is a reasonable and responsible thing to call your doctor's office and ask whether any temporary adjustment makes sense rather than assuming everything will sort itself out. Speaking of feeling fine, let's talk about a sensation that a lot of people do experience and one that is worth taking seriously rather than simply pushing through. Number 6, dizziness, especially when standing up quickly, is a known effect of all 3 of these medications, and for older adults, this is not a minor inconvenience, it is a genuine fall risk. When you stand up suddenly, your blood pressure needs to adjust quickly to keep blood flowing properly to your brain. Blood pressure medications, by their very design, can sometimes make that adjustment slower or less efficient, particularly right after you start a new medication or if your dose has recently changed. This is sometimes called orthostatic hypotension, which is simply a medical way of describing a drop in blood pressure that happens when you change position. The practical advice here is simple but genuinely protective. When getting out of bed in the morning or standing up after sitting for a long period, try pausing for a moment. Sit on the edge of the bed for a few seconds before standing. Stand up slowly, and if you feel lightheaded, hold on to something sturdy nearby until it passes. This single habit, small and almost too simple to seem important, is one of the most practical fall prevention strategies available to anyone on blood pressure medication, and it costs nothing and takes only a few extra seconds. It is worth thinking about this in the context of how many falls actually happen. A fall does not usually happen while someone is out for a brisk walk with their full attention on their surroundings. It far more often happens during an ordinary, forgettable moment, getting up in the middle of the night to use the bathroom, standing up quickly after finishing a meal, or rising abruptly when the phone rings. These are the exact moments when a brief head rush from a blood pressure medication is most likely to catch someone off guard, especially in a dim hallway without much to hold on to. That is precisely why this particular tip, pausing before standing, is not a minor suggestion buried at the bottom of a list. It belongs near the top of the list of habits that genuinely protect independence over the long run. That leads us into something that connects several of these medications together. Because dizziness is not the only thing that can be made worse by another very common category of medication that many people take without thinking twice. Number 7, over-the-counter pain relievers, specifically NSAIDs like ibuprofen and naproxen, can interfere with how well these blood pressure medications work. NSAIDs can cause the body to retain more sodium and fluid, and they can also affect blood flow to the kidneys in a way that partially counteracts the blood pressure-lowering effect of medications like Losartan and Lisinopril. This does not mean you can never take ibuprofen again. Occasional use for a headache is generally a different situation than regular ongoing use. But if you find yourself reaching for NSAIDs frequently for arthritis, pain, or chronic discomfort, it is genuinely worth discussing with your doctor or pharmacist because there may be alternatives like acetaminophen that do not carry the same interaction, or your doctor may want to monitor your blood pressure a bit more closely if NSAID use is unavoidable. This is one of those interactions that rarely gets mentioned explicitly simply because pain relievers feel so ordinary and low risk that most people never think to connect them to their blood pressure medication at all. Consider someone managing ongoing knee or hip discomfort, common enough at this stage of life, who has been reaching for an anti-inflammatory pain reliever most days for months without really thinking about it as a medication in the same category as their blood pressure prescription. If their readings have quietly crept upward over that same stretch of time, it is easy to assume the blood pressure medication has simply stopped working as well as it used to, or that the underlying condition has worsened. In some cases, though, the real explanation is sitting in the medicine cabinet the whole time. This is exactly the kind of connection worth bringing up directly with your doctor. I've been taking an anti-inflammatory pretty regularly. Could that be affecting my numbers? It is a simple question, but it can save weeks of confusion. Now we're getting to one of the most important points on this list. The kind of information that once you hear it tends to stick with you, because it involves a mistake that is unfortunately common and can be genuinely dangerous. Number 8, never stop taking these medications suddenly on your own, even if you feel completely fine or believe your blood pressure has improved. This is one of the more serious mistakes people make, often with good intentions. They feel great, their readings have looked good for months, and they think, maybe I don't need this anymore, so they simply stop. The problem is that these medications did not cure the underlying condition, they were managing it. Stopping suddenly, particularly with certain blood pressure medications, can cause blood pressure to rebound, sometimes rising higher than it was before treatment even started. This rebound effect can happen within days of stopping, and in some cases it can happen fast enough to trigger a genuine medical emergency, including a sharp spike in blood pressure that requires immediate care. If you and your doctor decide together that it might be appropriate to reduce or stop a medication, that is a conversation and a process often involving a gradual taper and closer monitoring, not something to do unilaterally over a weekend because you felt encouraged by a few good readings. If cost, side effects, or simply wanting to take fewer pills is the reason you are considering stopping, say that directly to your doctor. There are almost always options to discuss, but the path there should go through your doctor, not around them. There is also a related situation worth mentioning, which is running out of medication unexpectedly, whether due to a delayed refill, a travel travel mishap, or simply forgetting to reorder in time. An occasional missed dose here or there is generally not the same emergency as an intentional extended stop, but going multiple days without a refill because of a logistics issue can create the same rebound risk described above, especially with certain medications in this category. If you know a trip is coming up, or if you've noticed your refill is running low, handling it a few days ahead of time rather than the day the bottle turns up empty is a small habit that prevents an entirely avoidable scramble. And that brings us to the final point, one that ties everything together and gives you a practical tool you can start using today, regardless of which of these medications you take. Number 9. Home blood pressure monitoring is one of the most valuable things you can do to understand how well your medication is actually working for you personally. A blood pressure reading taken once every few months at a doctor's office gives your doctor a snapshot, but it is just that, a snapshot, sometimes influenced by the stress of the appointment itself. A phenomenon doctors sometimes call white coat hypertension. Home monitoring, done consistently, ideally around the same time each day, gives a much fuller picture of what is actually happening in your body day to day. A simple, validated home blood pressure monitor, the kind that wraps around your upper arm rather than your wrist, can be a genuinely worthwhile investment. Keeping a written log, even a simple notebook with the date, time, and reading, turns vague impressions into real data your doctor can actually use. If you notice a pattern, readings consistently higher in the morning or unusually low readings that leave you dizzy, that pattern is far more useful to your doctor than a single number taken once in an exam room. This one habit, tracking your numbers consistently, puts you in an active, informed role in your own care, rather than simply hoping the medication is doing its job silently in the background. A few practical notes on doing this well. Try to measure at roughly the same time each day, since blood pressure naturally fluctuates over the course of a day, and consistency makes patterns easier to spot. Sit quietly for a few minutes beforehand, rather than measuring immediately after climbing stairs or having coffee, both of which can temporarily raise your numbers and give a misleading reading. Make sure the cuff is positioned at roughly heart level and avoid talking during the measurement, since even conversation can nudge the reading upward slightly. None of this needs to be complicated or turned into a source of stress. The goal is simply a reasonably consistent routine that gives you and your doctor real usable information rather than a single number taken under less than ideal conditions once every few months. So let's bring this all together. Amlodipine, Losartan, and Lisinopril are 3 different types of medications working through 3 different pathways, each with its own particular side effect pattern to watch for. From swelling with amlodipine to that distinctive dry cough with lisinopril, grapefruit can interact with amlodipine in ways that intensify its effects. Salt substitutes and potassium levels deserve attention if you're on losartan or lisinopril. Kidney function is something worth monitoring through routine lab work even when you feel fine. Dizziness upon standing is common enough to warrant a genuine change in habit, not just something to shrug off. Everyday pain relievers like ibuprofen can quietly work against your blood pressure medication if used regularly. Stopping any of these medications suddenly without your doctor's guidance can be genuinely risky, and tracking your blood pressure at home gives both you and your doctor a much clearer, more complete picture than occasional office visits alone ever could. None of this is meant to replace what your doctor or pharmacist tells you, and if anything in this video reminded you of a symptom you have been experiencing, especially something like persistent dizziness, unusual swelling, a cough that won't go away, or anything that feels different or concerning, that is worth bringing up with a healthcare professional rather than waiting to see if it resolves on its own. The goal here is not to alarm you, it is to help you walk into your next appointment with better questions and a clearer understanding of what these medications are actually doing for you. If you found this helpful, we would genuinely love to hear from you in the comments. Are you currently taking one of these 3 medications, or perhaps more than one together? Which of these 9 points surprised you the most, or was there one you had already learned the hard way? And if you don't mind sharing, let us know roughly how old you are and what part of the world you're watching from. It always means a lot to see just how many different corners of the world this community reaches. Thank you for spending this time with us today, and we'll see you in the next video.